my name is Megan Graver. This is my manual restraints keeper 2 video. I have Kathy, my lovely assistant, and then Hannah's my holder. Just while we're starting off, what we're going to be doing is Hannah's always going to be communicating with me while I'm doing this for safety purposes. And when we use manual restraints, it's to help us do something in relation to our horse. But we don't want to use manual restraints aggressively. We want an experience to be positive for them. So ideally, we want to try to use our voice as a restraint. We want to try to be gentle and work with them through it. We also have chemical restraints. Chemical restraints are any kind of drug, like ACE maybe, when we're trying to clip ears or something like that. You ideally don't want to use the chemical restraints unless your horse absolutely needs it. Restraints are not an excuse for not taking your time and not being slow about it. But I'm going to go through your restraints today and talk about how you use them, how you apply them safely, and what they're kind of going to do. So we're going to go ahead and we're going to start with our chain shank. We have 2 uses for this. We have it going around the nose and we have it going under the lip. So the first one I'm going to show you is going around the nose. So if you want to come on over closer, what we're going to do is, how we put this in is we first want to make sure that our chain shank is long enough for it to attach over to the other side of our halter safely. I'm going to go up and through. Okay, we'll have it wrapped around once. I'm going to come over, back up through the other side, making sure that this is pulled tight, and then we're going to clip up here with this part of our clip facing out so it doesn't rub him. And then we have that there. The key to having it wrapped around the noseband is so the chain doesn't have direct pressure on his nose, which if used improperly can actually cause damage. So you're always going to pull down with the chain shank. If we try to pull up, he can just come up away from us. So you're always going to apply down and just be aware. Now for the lip twine, or lip chain, I'm going to do the chain first. All we do with this is we're going to feed it through one side, come under the lip, we're going to feed it up and through, and clip it to the other side. Now we're going to feed it up into his lip and pull down. Now this is a little bit more of a severe restraint, and I'm not going to make him hold it for all that long. But all that does is it's another thing. It works as a distraction mainly. Right. Now for our lip twine, which is pretty much the exact same as the lip chain, except the twine is a little thinner, so it can be considered more severe. Some people consider the chain more severe because it's harder, it can pinch. But for the lip twine, all we're going to do is we're going to tie one end to one side of his halter. Make sure that's secure. And then it's the same thing. We kind of feed this underneath his lip. We can pull to the side and then pull down. And the thing about the twine is if you really need to, you can actually tie it to this opposite side if you're doing a procedure, but you want to be able to take it off if it's making your horse uncomfortable or not. And then you just release it, let it back out. And there's that. Now, the next restraint I'm going to show is going to be our shoulder roll. Now, all our shoulder roll is you're going to kind of grab a bit of skin along the shoulder on the neck where there's some loose skin. What this is it's kind of a pain and a distraction, and it's a good go-to. So, I'm just going to grab some skin and I twist and I pull. Now, I'm going to be paying attention to where his feet are, where my feet are, what my handler's doing. And the thing about this is it's really hard on your hand. You can only hold this for so long. It's really strenuous, but it's good for short, quick distractions. Like if your horse is kind of okay with his ears, holding it and booking out his ears really quick is going to make it effective. Now, we're going to go ahead and do a leg lift. For the leg lift, this is like if you're going to be doing something with the feet and he wants to be lifting his leg, you're never going to lift a back leg. The reason for that is because if they kick, it's a little more unstable, it's a little more dangerous. It's way easier to handle the front legs. How this is going to work is if you want to work on this back leg, you're going to want to hold the same front leg. Why is because if he tries to pick up that leg, he's only standing on his opposite 2 lateral feet, which means he's going to fall. If I were to try to pick up his other leg, he can balance on that diagonal pair. So if I'm ever trying to do anything, I'm going to calm down. lift up his foot and hold. My feet are gonna be to the side. I'm gonna be in a squatted position. Okay, I'm gonna be communicating with my handler. I'm gonna be watching his hind end. She's gonna be letting me know about his body language, anything going on like that. And if I wanna do a front foot, let's say I wanna deal with this front foot, follow me over to this side. I'm just gonna go ahead and pick up his opposite front foot. Because if he tries to pick up this opposite leg, and he doesn't have anything in the front, and he's gonna fall. Once again, just being aware, my feet are together, they're off to the side, so if he tries to step down, I'm not gonna get stepped on, I'm holding secure, communicating with my handler. Good boy. Last but not least, we have our twitch. The thing about the twitch is it can become a weapon if you let it go. So it's really important that regardless of what we're doing, we always hold on to this bar of the twitch. So how we're going to apply the twitch is I'm going to flip this over my fingers, but they're not behind my knuckles. I'm going to come over to his lip, grab his lip, slide it on. Now the thing about these twitches is I can kind of hold it between my arm and start twisting, and that's going to hold. It's going to get tighter around his lip. Hold it. Is going to hold like that. So I'm going to apply it again one more time because it didn't quite stay as well as I wanted the last time. And all that means is I need to twist it the opposite direction, because on some twitches, they're going to twitch better one way than the other. So I'm going to hold this tight. I'm never going to let go. And you're going to be able to perform the task you want. You ideally want to undo the twitch as quick as possible, because the stages of the twitch is first it acts as a distraction phase. They're kind of trying to figure out what's happening on their nose. Then you have the analgesia phase, which is where it kind of almost becomes a drug and it starts releasing the endorphins. But you want to be aware of the twitch, that you have a limited time before it becomes painful. And when the twitch becomes painful, it can hyperactivate and excite your horse or really upset him. And then the experience is going to be negative. And the key to doing your manual restraints is for it to be a positive, quick experience, because you don't want them to associate with being negative. So that's how you properly use restraints. You never want to use your restraints as your first go-to. You want to try to be patient, work through it, be slow. So being safe and being aware. Thank you.